title?
My title, I'm assistant professor here at the School of Public Health, and in the Adventist Health Study, I am the senior nutritionist or nutritional epidemiologist.
So your training is in the area of nutrition?
Nutrition and epidemiology.
And what does that mean in terms of what you do?
Okay, what
for
that
a
means.
lay person?
Okay, what that means for the Adventist Health Study, my main area is nutrition assessment of the diet, whether it's at the level of nutrients, foods, food groups, or patterns, or biomarkers. Yeah, so that's.
What is the overall importance of nutrition in healthcare?
Healthcare. Okay. Well, nutrition is actually just one component. Let's say prevention. Okay. Nutrition is only one important component of preventive healthcare. The other important factors are physical activity, rest, say for example, and I forgot, physical activity, oh yes, avoidance of destructive behaviors such as abuse of cigarettes, alcohol, those drugs. So those are all part of preventive healthcare, if you will. And so, and as I said, nutrition is just one of those components.
I was treated in the Adventist system when I had migraines, and the first thing that they did was do a nutrition study to see if there were any food triggers or allergies that were causing this. Is that a difference in the Adventist approach to public health? I mean, is nutrition one of the components of a difference in looking at public health from an Adventist point of view?
Well, that's, I think, a multifaceted question that you're asking. So if you are talking about a particular, you were treated for, what was it?
Migraines.
Migraines, okay. So that's a specific condition, medical condition. And so you will have a very focused treatment, or they will look specifically at particular nutrients, say for example, or foods that are specific to that condition. Okay, now if you're talking about public health, what it does for public health, so now when you talk about public health, the patient is not just one individual, but the patient is actually an entire population, and there is a very big difference about how you manage like say, you know, an epidemic of obesity, say for example, or an epidemic of heart disease, things like that. And so, and as far, now specifically your question has to do with Seventh-day Adventists. When you look at public health and Seventh-day Adventists, I mean, do you assess them differently from the other population? You don't. You would do the same kind of assessment, but what you will find is there is actually a difference in how Adventists perhaps eat, and there is a difference in the way, there's a big difference in different and other kinds of behaviors, such as smoking, which they avoid, alcohol intake, which they also avoid. Coffee is one of those beverages that are taught among Adventists to also limit the consumption. Okay, and so those things will be very different immediately. So then, as far as a message to the population, so then if you find that in the Adventists there's less of a particular disease, say heart disease, and you find that the reason is because they're eating more plant-based diets, and they are not smoking, and they are not drinking alcohol, then a public health application of that information is to recommend to the rest of the population to do something similar as what the Adventists are doing.
And that leads us right into the longevity study.
Okay.
And what the findings were in the first study and where you're going now with the larger cohort.
Okay. So in the Adventist Health Study 1, which was conducted in 1970s up until close to the 1980s, what Gary Fraser actually did an analysis on the 34,000 California Adventists, which is the population for AHS1. Okay. He looked at that population and compared them to other Californians who are not Adventists. And he looked at their choices of diet, physical activity, and body weight, and use of hormone replacement therapy, and I can't remember, and smoking. Okay, he looked at all of these different factors and the combination of those, and what he found that California Adventists have higher life expectancy than other Californians by about 7 years in men and about 4.4 years in women. So that's and besides that finding in the Adventist Health Study 1, they were also able to identify specific foods that had either detrimental or beneficial effects on, say, cancer or heart disease, or death from heart attacks, or from stroke, things like that. And so they were able to identify specific foods, and also in some studies they were able to identify patterns like vegetarian diets and non-vegetarian diets. So then, and again, that was just in California Adventists and only in white Adventists. So then there was a need to find out if you would have the same effect in Adventists in other parts of the United States and in Canada, and also even more importantly, if there's the same effect or different effect among Black Adventists. And so the Adventist Health Study came to being, suppose, and which is now in progress. And in this cohort, we have over 96,000 Adventists, white and Black Adventists in the US and Canada participating. And so with this study, we should be able to answer those questions, and also answer more specifically questions about vegan, lacto-ovo vegetarian, pesco, semi, and non-vegetarian diets, and how they differ, how those dietary patterns have different, or people who consume those types of diets, how their experience with diseases will differ. Then we will also be able to look at diet at the level of nutrients, which was not, which they could not do before. Okay, and so then an additional component in another sub-study of the Adventist Health Study 2 cohort is what we call the calibration study, and it's composed of a representative sample of the entire cohort, about 1,000 people, where we were able to collect more detailed dietary information. So from these 1,000 people, we have 6 24-hour recalls from each of them. So we have over 6,000 24-hour recalls to play with and to see different patterns, different ways of we might be able to see if the way foods are prepared also make a difference. And then we will also be able to look at specific ingredients and if if they have even any effect, or if they add or beneficial effects or are more detrimental than others. So
we talked a little bit about specific foods, like meat analogs, like tomatoes. In the first study, what are the kinds of things that we think we know that you'll look at more? You talked about nuts. What are some of the things we think we know that you're kind of looking at more specifically in the second study?
Yes. Okay, so in the first study, we found that nuts actually confer a protection against death from heart disease. Okay, and then we also found that tomatoes was protective against prostate cancer, and we also had a study on soy milk and prostate cancer, I believe. And so then now with the Adventist Health Study too, we will be able to expand that, if you will, and see if say, for example, nuts, we'll be able to test if nuts offer any protection against any type of cancer, say, for example, and we'll also be able to see if and in the Adventist Health Study, we also collected blood and urine and adipose tissue. So now we will also be able to look and see if any of these foods have any effect on blood or urine levels of the markers of either the diet or some kind of disease outcome. Okay, and then we will also be able to see with more certainty, because of the large sample size, if vegans compared to non-vegetarians or lacto-ovos against non-vegetarians have a different experience as far as the disease outcome. It could not be done in the first study because of the smaller sample. So,
what is in the data that was gathered in the first study that is being gathered, what are your surprises?
One of the things that we were surprised about is that we actually have different vegans, different types of vegans perhaps, and we are also finding that our non-vegetarians are not actually heavy meat consumers. They do eat meat, but not as much as we thought. And they actually consume a large amount of plant foods as well. So that was a surprise for us, and because of it, we're excited that now we'll be able to study just the non-vegetarians, to see if even we can identify different types of non-vegetarians. I mean, are there low-fat low-fat consumers of non-vegetarians and high-fat consumers non-vegetarians, and then see if their diet, those two different diets have different effects on different health outcomes. So that was one of the surprises for us. For now, of course, we have not looked at cancer just yet, because we will be soon, starting this year and next year, we will start to work on those papers with our cancer outcome, because up to this point we've just been collecting more data, more cancer data. So,
are there myths about nutrition that you've experienced in what you do?
yes, the biggest one and the most prominent one that I can think of off the top of my head has to do with nuts. The myth is that nuts are high-fat, high-calorie food, therefore don't eat them. And in fact, there was a time when dietitians and the medical field would not recommend eating nuts because of that. But in fact, the research is showing just the opposite. And so nuts, tree nuts specifically, confer protection against heart disease. And that's been shown over and over again. And it's because of the fatty acid profile of nuts. It's relatively high in polyunsaturated fats, and some nuts are relatively high in monounsaturated fats, such as almonds. Okay, and then they also contain a lot of antioxidants and polyphenols and magnesium and calcium, and so all of these different nutrients individually have some benefit, but also and also fiber, but they also are high in fiber. And so as nutrients individually and as a collection of different nutrients, they actually are very beneficial for health.
What should I have asked you that I didn't ask you?
Let's see. Well,
and there's no hurry. I mean, you know.
Okay. Just kind of what would be what? Okay. Let's see.
I've seen a bunch of documentaries lately on health, and they stated that the people that had more sort of a meat diet than the vegetarians, and dating back to certain civilizations in Asia, they did this census, I guess, is that they were more prone to heart disease and cancers.
The meat eaters.
Yes.
Yes, that's being shown. Also, we are able to show that. Okay, so there is one thing that I forgot to mention. When you asked about nutrition and prevention, say for example, okay, many times this body weight gets overlooked as being part of nutrition status of a person. In fact, it is part of nutrition. Body weight is part of nutrition. And so this problem with obesity or being overweight it makes health very complicated, because overweight and obesity is associated with increased risk of cancer, heart disease, diabetes, and high cholesterol, all of these things. Just by losing weight, possibly, could actually decrease the risk for some of these different outcomes. And so body weight is a very important component in nutrition and prevention.
And this is children all the way to adults?
All the way through adulthood. And so, so maintaining body weight is another factor or lifestyle that is important in good health and prevention of disease.
Could we have her say it one more time? I could hear her.
Oh, okay. So what part?
That last two
nutrition.
Yeah.
Okay, so maintenance of good body weight, meaning to say not overweight and not underweight. Maintenance of body weight all throughout life is a very important component of nutrition, and it is very important in prevention of disease and also good health.
Yeah, interrupt? Yeah, so
No one's interrupting. Everybody does. Go ahead.
Your discussion earlier when you were talking to Dr. Eselda about like some of the interesting things they found, you said something about if you're strictly vegan, it doesn't necessarily mean that you have the healthiest.
Oh, yes, that's right. So another, So another surprise.
You alluded to it when you were talking about lacto-ovo, but you didn't say it as strongly this time.
Exactly. So another surprise. That was what is. So another surprise for us is that one would expect that people who consume a vegan diet would have the lowest risk for any number of diseases or any conditions. But this is not always the case, at least in this study. So while vegan diets might be most beneficial, say, for maintaining body weight, it may not be the best for other kinds of conditions. And so for example, as you're aging, the body would naturally lose some vitamin B12. And vegans are at particular risk of being deficient in vitamin B12. So as they grow older, it's almost a double whammy, so to speak. And so as far as adequacy of the diet, vegan diets is something that we need to be looking at very carefully. We really have to study that to see if the vegans in our group are, in this population, know enough about the diet so that they are able to compensate, or they are able to get the necessary nutrients or necessary food or supplement to be able to have adequate intake for these specific nutrients. Yes.
Thank you.